Next, from the state capitol, we hear testimony on changes being made to healthcare coverage provided by the state. Members of this committee that includes both House and Senate members question why one insurance provider, who offered a lower bid, was eliminated from consideration as an insurance provider. This runs about 30 minutes.
Senator Rose.
Thank you, Mr. Chairman. I don't even know where to begin. We'll start with some miscellaneous.
Okay.
So 3 weeks ago, you announced this with no information to my constituents, left them largely in the dark for the better part of the last 2.5 weeks before sending some information out last Friday that when you read it, I'm a lawyer, I don't understand it. But let's try to clarify a few things for my constituents, of which many are scared beyond belief. And by the way, last time y'all appeared in front of me, we had a very long discussion about the better communication and outreach that was going to come to the people of Illinois via the RFP process that was going to come over the summer. So I don't really know what to make of that given the events of the last 3 weeks, but I guess I'll take anything said here with a grain of salt. Deductible, the $1,300 deductible that was mentioned for people going to the PPOs. We're already midway through the current fiscal year. People have already started paying on deductibles. Will they get credit for what they've already paid? Because my understanding of this is that under the contracts that are to be awarded, they're not allowed to get credit for what they've already paid.
Okay, first of all, it's a $1,300 out-of-pocket, not a deductible. Okay. So under the state plan, there's a $100 deductible. Under TRIP and SIP, there's a $250 deductible. There is no mechanism to waive.
I'm sorry, maximum out-of-pocket's $1,300.
Maximum out-of-pocket
Okay.
under the state plan is $1,300. Under the TRIP and SIP plan, it's $1,000.
Okay.
There is no mechanism under a Medicare Advantage plan for me to waive that deductible to the plan. However, it's our plan, we manage it. I'm currently working through issues with my staff to address where people have paid with the current carriers to do our best to hold the member harmless. With that said, however, you're talking about a plan that's now going to run an additional 6 months longer than what the members are used to. So although members may have already met a deductible now, they will not have another deductible until next January. So it's 6 months, one way or the other.
When you say January, you're saying January 14 or January 15?
January 15 would be, if I waive a deductible today, then that means the deductible that they were responsible for last July now becomes an 18-month deductible rather than a 12-month deductible. Because they wouldn't have a new deductible apply until January 15.
So it's your intent to figure out some way to hold people harmless?
It is my intent to figure out some way to hold people harmless on the medical deductible.
You said the letters are going out today.
The letters for TRIP and SIP have already been mailed. Some of the state members have been, letters have been mailed. We use internal printing and internal mailing at DHS.
Does that mean the contracts have been signed then?
The contracts have been sent to all the vendors, and it is to my knowledge, every vendor who has joined us here today has brought back or emailed us electronic copies of those signed documents.
Okay. Something that I clarified on my own because it's not on the website, and by calling Carl Hospital or Carl folks yesterday about the issue of whether or not people have to pay up front. Thankfully, I was told that Carl doesn't intend to force people to pay up front. So I'm just stating that for the record from my own phone calls on this matter, because there's been no information from the state on that to my constituents, and I would expect them to adhere to that. Last night I happened to go to a very interesting lecture on the rollout of Obamacare, both in Illinois and nationwide. And there was a big discussion at that lecture about how the federal government is trying to downsize Medicare Advantage and, trying to maybe push it off into a corner. You just heard Senator Severson talk about a lot of the positives of a Medicare Advantage environment. But with the feds trying to move that down, one of the things that was noted in the lecture was that United, who has been chosen now, and I think most of my constituents will, not most, but many of my constituents will go to the United PPO, just laid off or ended their contracts with doctors all over the country. And one of the things that was said was that they have 98% coverage rate. Well, I heard this at this lecture completely by chance last night. I went in and Googled United Health, and indeed, all over the country, they've stopped their contracts under Medicare Advantage plans. Being that this is called Medicare Advantage, but it has to adhere to the state contract requirements, is that going to impact their network of doctors?
The network is irrelevant under the United plan because the member can go to anyone who accepts Medicare. As a general rule, however, I've seen those articles and we've seen that information as well. That is more of a function on the commercial individual plans than it is on the commercial group plans.
That's why I'm asking the questions, because
I understand, sir.
It alarmed me in a quick Google search last night.
It alarmed me too.
Yielded all over. So we're here because of the state contract, correct? Whose idea was the Advantage program? Was that the administration?
It was a decision made during the master negotiations between both parties at the table.
Okay. So who put that on the table?
Senator, I don't know that I can give you a well-thought-out response on that. And
I think in one of our previous hearings you had a response.
Did I?
Yeah.
Okay.
No comment today.
Well, if you can recollect for me, at the previous hearing in the spring, that was a little bit closer to the February the 28th finalization of the contract with the AFSCME.
Okay.
So
let's switch here to the procedure of this. And I'm a little fuzzy on Mr. Brown's role. Is Mr. Brown a policymaker, or is he here to ensure that the process is followed correctly?
Senator, I was not involved in the establishment of the policy. The legislation that was enacted and signed into law by the governor established the chief procurement officer to oversee the procurement related to this coverage, but the program individuals, the folks that are responsible for the policy side, are within the administration and Janice's shop. They set that policy.
So this bid spec that went out that basically made it impossible for some people to qualify, that Senator Frerichs, Chairman Frerichs is referring to, about the needing to have 1,000 lives covered in private or 500 lives covered in a governmental entity, that bid spec came from the administration?
That's correct.
Okay. Did they consult you during that process?
Yes.
So if you are not a policymaker, why did they consult you?
Because as part of the procurement, that would have been one of the criteria set as a standard for all firms to be evaluated by. And our performance in this process was to make sure that all companies are evaluated by the same standard. So our questions were, okay, have you set a standard? The answer is yes. Next question, what is the standard? They've described the standard, 1,000 lives here, 500 lives on the public side administered. And as I mentioned earlier, my next question was, that seems very, very low as it relates to how large our insured pool is. And what we discussed, again, is the consultation that CMS had with their team, with Siegel, about what other
Does the federal
jurisdictions
government certify people as Medicare Advantage programs?
I believe they do, but I would have to defer to the program.
So if you have a federally certified Medicare Advantage program, why do you need a separate spec?
Senator, I think that being federally certified to be involved in a Medicare Advantage program is different than providing the service to an identified constituency.
So if Health Alliance bid this contract and bid all 100 plus counties of Illinois, that wasn't good enough but it is okay to award a contract to a company that only provides 2 counties in Illinois?
The
So-
information, I'm sorry, ma'am.
I was going to say, Senator, that wasn't a measurement that was used. There's not a comparison between whether they bid 102 counties or whether someone else bid 2. That wasn't
Right, that's
an
my
evaluative
point.
factor.
I mean, this seems a bit asinine that you have this factor in there at all. I mean, if you have a company that's good enough for State Farm and Caterpillar to insure their employees, why on earth wouldn't it be good enough and they bid a statewide contract? But this, you're not the policymaker, you're the policymaker. By the way, the governor was in my area earlier, well, last week and said this was your decision, Mr. Brown. Do you have any comment on that?
I understand that he made those comments, and the thing that I can establish for you today is that the programmatic responsibilities of administering these benefits are the administration's responsibility.
Okay, so Janice,
Yes, sir.
this is your responsibility, this is the administration's decision.
Absolutely.
You have a company that bid statewide that was knocked out before it ever bid based upon the specs you put into the deal, into the RFP. Why did you put those specs in there?
Because we think those thresholds were reasonable based upon the size of the procurement we were doing.
So at the end of the day, okay, let's talk about reasonable. Because at the end of the day, for the taxpayers to get a good deal, you have to have a healthy pool of bidders, correct?
Correct?
And they have to bid here and bid there, and eventually you get the lowest bid, and then the taxpayers get the most bang for their buck, right? That's kind of the theory here.
Yes, sir.
Today's News Gazette says that Health Alliance, who was out before they even bid under your specs, bid anywhere from 24 to 124% less than the winning bidders. Now, I don't care what your rationale and reasoning was for your bid specs. You're telling me now, today, and this is how it sounds to me, and I think most of my constituents. You're telling me that your bid specs took a company and you deemed it wasn't worthy, despite the fact that Caterpillar, State Farm, dozens of governments around the state of Illinois, I believe the city of Champaign has them, for Medicare Advantage. The federal government says they're okay for Medicare Advantage. Bid the entire state of Illinois, but because they didn't have enough people in their initial pool, we're going to throw them out before even scoring them, even though at the end of the day, they're 24 to 124% cheaper.
I think the winning ones would have been 124% greater.
Right. They're cheaper.
Yes, they're cheaper. I don't think you can be
The point
124%
is,
less than.
you've got a process that knocks them out before you even score them, and at the end of the day, the taxpayers, you have the Medicare Advantage opportunity to save money. The taxpayers have a right to those savings. Could you have gotten more savings without that requirement, one, which you put in there on behalf of the administration, which you, Mr. Brown, could have waived but refused to waive, which I find, by the way, you can say you're not a policymaker. The minute you refused to waive it, you became a policymaker. They're out, and then the procedure gets even more interesting. You file a request to get the information to file a protest, so you're the company. You file a request for information so you can file your protest. The administration says, oh, we're going to need more time on that, and conveniently waits out the period of the protest to file. They request from you, Mr. Brown, an extension of time citing, hey, we don't have the right information back yet to actually file or even decide if we want to file a protest. You deny their extension of time, and then conveniently after their extension of time is denied, the administration gives them what they need to file with. And by the way, this commission here asked on October 3rd for the documents that we got when? Yesterday. Yesterday. Now, what am I to take from all this?
Under the procurement code and the procurement process, there are certain steps that we are required by the law to follow. So to a point that you made some time ago regarding the lack of information being put out, as you can well imagine, as we've been through before in front of this commission, from the moment the award is announced until the dispute period or protest period is exhausted, the hands of the agency running the procurement are tied. So in the first week, There were multiple messages put out by Health Alliance regarding this procurement and what did or did not happen. My recollection is the first response put out was, we have no idea why we weren't chosen. The second response was, it was a mere technicality. And the third response was, we didn't meet the minimum mandatory requirements. Health Alliance was advised before Labor Day that they did not meet the minimum mandatory requirements on this procurement.
And they asked for a waiver, correct?
Not of me, sir.
But from him?
Yes.
And under the procurement, there is an opportunity for a potential bidder to ask for a waiver, to ask for the specifications to be modified or to challenge those specs. That is standard language in any procurement that we do, and the bidder has 7 days from the release of the procurement to make that challenge. No such challenge was made. There were 2 separate communications from my office back out to Health Alliance in an effort to resolve whether or not these specifications could be or were met by Health Alliance. The first was sent to Health Alliance on July 23rd, and it requested that they explain to us how they met the specs. And with response to the HMO product, which we are focused on, the response was Health Alliance serves 107 employer groups, including public sector groups. When you combine the totals for all government groups, we meet those requirements. To your comment, sir, regarding State Farm and Caterpillar, that is not a separate independent contract with those companies in Health Alliance. Health Alliance is simply one of many vendors that can be accessed by their employees on a Medicare exchange.
That's the point.
There is no Medicare exchange, sir, for the state of Illinois.
I guess what I'm saying to you is, if it's good enough for them, what's the problem? But look, there's a lot of people who want to ask questions. I'll simply conclude with, you have a process that from the beginning looks like it was set up to exclude a company from bidding. At the end of the day, we find out today that they would have been the cheapest bidder if they'd been included. In the meantime, my constituents will be going to the PPO through United, and guess what? The taxpayers are going to pay more than they would have otherwise paid in the HMO. I mean, they're all HMO Health Alliance people now. Well, now they're going to go to PPO, and they're still going to go to Carl or wherever they're going to go, but the hip surgery that they get is going to cost the taxpayers more, and them, I might add, because now they're on a 10% coinsurance. I find this absolutely baffling that this is the level of service commitment we have out of this after the number of questions that have happened over the last 2 years about this. This committee, we find out yesterday that we get the documents back. I mean, frankly, I think we ought to have substantive committees of the House and the Senate convene with subpoena power and put you guys under oath.
We hold the applause and the comments. Do you have any response to that?
No, sir.
Do you have any idea how much money could have been saved if the bid that wasn't considered had been awarded?
Under the procurement code, once a bidder is excluded from the procurement, the agency has no authority to open the technical specs or the pricing specs of that procurement. Those documents simply aren't looked at by the agency running the bid.
Are those documents available for the public? I mean, in the interest of transparency here? I mean, so then how is this information released? I mean, I realize we want to have procurement reform. We want to make sure things are done right, but we also should make transparency part of our legislative process as well.
Senator, documents are certainly available, and the analysis that, and I believe that this is the basis for the analysis that's before you. Health Alliance has the opportunity to compare their own numbers against those numbers that were awarded and those numbers that they sought information on. So they certainly had had those numbers available for their analysis. Now, as far as any member of the public, all these documents are public. Now, one of the circumstances that does exist within the frame of insurance company bids is that the companies, and I believe all companies, have expressed the requirement to redact the formulas by which they arrive at their final computations, because
Okay.
those are proprietary. Those
Sure.
those
We
end
just wanna
numbers
know
are
how much
certainly
the
available.
taxpayers could be saving. And you say that you haven't looked at that, don't care to look at that, can't look at that.
We don't, as a matter of practice, we don't evaluate disqualified bids. We don't take them through to the end of the process. Even if we had, we would have to take, we would, essentially what we would do in normal circumstances is rebid. We would cancel everything and start over if we were to find something so anomalous. But this circumstance is not uncommon.
Case management and care management, but they're simply not as good at that as a private insurer is.
Because
The private insurer does that in all of their books of business, because that's what saves the private insurer money. If you're a diabetic and you're non-compliant, it helps to save money if the private insurer is working with you to get you compliant, to get you case management, to get you nurse management. Where on the Medicare side, traditionally, it's just, well, we're just paying the diabetic bill, whether it's the insulin or it's the emergency room or whatever it may be. So it's case management and care management. There are nurse helplines, there are,
I understand, I'm sort of trying to make a point.
Okay.
Because also history tells us that Medicare Advantage, maybe not the way we're going to run this system here, but that Medicare Advantage has had a lot of problems also, and cherry picking and other kinds of things. So, so it's not to let this very important problem that we're dealing with today get in some other debate about, the federal government's ability to deliver health care. I just wanted to, to make that point.
Yes, sir.
It still is part of it. Thank you.
And we also had one other member fill out a witness slip if they could begin to prepare themselves, Beverly Johns. Linda Brookhart, Executive Director of State University Newton Association. Floor is yours.
Good morning. Good morning, Senator Frerichs, Representative Tracy, and members of the Commission. I didn't come to argue or complain. I'm just bringing forth some concerns. As you know, it's already been stated that I'm the Executive Director of the State Universities and Annuitants Association. SUA advocates for all of the individuals within the state university's retirement system. Today, I am here on behalf of those who are having to make a choice between enrolling in the state-sponsored Medicare Advantage plan or seeking a Medigap plan from the private sector. I should also go on record that our organization has been pretty much an opponent to these healthcare changes as they have been rolled out. Our first and foremost concern has been the short, might I add, extremely short amount of time that has been allotted to inform the state, community college, and teachers' Medicare health insurance population of the changes being made to their health insurance. For many, the ability to process these changes will be quite distressing. Many will need assistance, as you can well imagine. Since before the month of May, SUAA urged people to be aware of the changes coming, to be knowledgeable about Medigap insurance, and ask people to make sure they read and understand the state-sponsored Medicare Advantage plan before making any decision. With all of our attempts, we realize that we have only reached a small percentage of those who will be affected by this insurance change. There was an informal briefing this past Sunday at the I Hotel in Champaign, hosted by the SUAA University of Illinois Urbana-Champaign chapter. Janice Bonneville, Deputy Director, CMS Bureau of Benefits, spoke to an audience of over 500 concerned retirees. The informational session went well as the Medicare Advantage plans were outlined. I repeat, outlined, because there are no visible plans available yet. We know they're coming, so we just kind of talk. We haven't actually seen anything. Many questions were answered, but since then, other concerns have been brought forward. These concerns are not just from those who are patients of Carle Clinic. These concerns now come from across the nation. Most people are not aware of or are confused by the information that these Medicare Advantage plans will only pay what Medicare pays. They have been used to everything being paid for them. There needs to be examples provided as to what the patient will now be responsible for, such as certain leggings, garments that are circulation necessitated and have always been covered by the current health insurance. There's other examples out there. In at least some of our places, doctors or the facility, there are facility fees for procedure and visits that do not seem to be covered. This needs to also be outlined and brought to the attention of people. There are doctors, clinics, and hospitals throughout the nation and some in-state that say that they will not accept United Healthcare in any way, shape, or form. I find this interesting because does this mean that United Healthcare and these entities have had negative experiences? If so, what has or is United Healthcare willing to do to make sure this health insurance transition is smooth, especially for the patient, those who rely on the doctors, clinics, and hospitals, places where relationships have been built over a number of years? If people use out-of-network doctors, clinics, and hospitals, and a lot of this happens in the more rural areas, especially out of state, how can we be assured that no one will have to make any of these payments up front? And I say that because, as you know, the state has been in arrears over claims. And while the state will be taken out of the mix because it's now being privatized, there still is some skeptics that the state of Illinois has their name attached to this. Maybe it's just no trust from the provider or no trust from those that are being insured. As we hear from our members, other concerns will be evident. As you hear from your constituents, other concerns will be evident. A serious burden of time pressure for anyone considering these changes or considering not enrolling in the new plan is compounded by the holidays approaching, people changing locations, and other things come into the mix. However, I know it becomes the responsibility of the retirees. Many of us are dedicated in a united effort to find family members, friends, caretakers, and others who can assist our most senior retirees in enrolling in one of the new Medicare Advantage plans. I hope all of you will be dedicated to this effort with us. It is unfortunate that a task such as this, completely changing the health insurance for our Medicare age-eligible retirees, was not done over a longer period of time. Rushing makes people anxious, causes people to undue stress, and of course, confusion that could have undeniably been avoided. Providing information to the Medicare population throughout the spring and the summer could have lessened the burden. It didn't have to be detailed, just letting people know that there were going to be changes would have been the right thing to do. But maybe the right thing to have done was align the Medicare Advantage plans with the 2014 Medicare enrollment. As we all know, transition and change do not always go smoothly. SUAA hopes that this transition works better than what is happening with the Affordable Care Act. And we do hope that everyone understands the necessity of enrolling in the new state-sponsored Medicare plans if one wants to be included. Education, education, education. We can only hope for the best in these next few weeks. Medicare retirees will be relying on all of us.
Thank you very much, Linda. Yeah, and education is an important part of this, and I know my office will be working with CMS to bring them into the district and meet with a lot of my constituents.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.